Just back from Brazil, Dr. Jon LaPook is here. Jon, I just have to ask you, I know you and your team spent hours and hours and hours, tremendous reporting, so heartbreaking to see these stories. What was it like actually being on the ground there?
Oh my gosh, Elaine, I'm gonna love my baby. That says it all, right? I mean, you can hear all the statistics, 1.5 million cases of Zika maybe in Brazil, thousands of babies with microcephaly, but when you look into the eyes of the parents and the babies, it's heartbreaking, and especially an 18-year-old, a 16-year-old, a 15-year-old mother, they don't know what's going to happen. They don't really totally understand it, and they certainly don't have the resources that they need financially to provide the kind of services on their own that their babies may very well need. So there are so many questions here, but it was just emotionally grueling for...
Yeah, I mean, because the outlook, you know, you talk about limited resources. What is the outlook for babies that are suffering from this in Brazil?
There's a huge spectrum. There are a lot of unknowns. It's the first time that, as far as we know, that a mosquito has caused or has been linked to causing microcephaly. There may be a spectrum of disease where babies are clearly very, very ill and they can die at birth. They may have neurological defects, or they may have this very mild defects. We saw a couple of babies like that, and the question the doctor said was, what's going to happen as they get older? They can have trouble swallowing, trouble hearing, maybe with vision. This is all developing, and there's so much that we don't know.
And so, just to be clear, does Zika actually help cause the microcephaly? I mean, what exactly is the link there?
So that is being vigorously researched right now. It has been linked to it statistically. It seems like the Zika infection seems to be present when the microcephaly is present. There was an outbreak of Zika over the past year, so it seems logical to think, but they haven't proven cause and effect. And to do that, they're actually doing a study where they follow one group of pregnant mothers who are infected, who have evidence of infection with Zika, other ones who don't. And at the end of that, they're going to go and say, okay, is there a higher incidence of microcephaly in the group of mothers that were infected?
And so, you know, the risk of an outbreak here is something that people cannot help but be concerned about when they see those images coming out of Brazil. What is the risk that something like that could happen here?
I think right now the cases that we're seeing in the United States are imported. So those are people who are infected elsewhere, they come here, and that's how they get it here. The risk is, and I actually think it's almost inevitable, if not inevitable, is that a mosquito somewhere in the United States, maybe in Florida, Texas, Hawaii, which has the kind of mosquitoes that can host the Zika virus, that it's going to eventually spread to those mosquitoes. And then, of course, I think there's going to be a lot of concern among people, because here's one of the problems. 80% of people who have Zika infection have no symptoms. So there are all sorts of questions about how do you know you have it. The blood tests for it are very good for active infection, pretty good. You know, if it's in your bloodstream for the first, say, 11 days, maybe a little bit more or less. But the test that says, did I have it 3 months ago, that's not as good, because there's confusion between yellow fever and dengue, other infections you can have. It's not a perfect test.
Okay, and how close, really quickly, how close are we to getting some kind of vaccine for this?
Dr. Fauci, the head of infectious diseases for the NIH, he said that they're going to start a phase 1 trial by the end of the year, but he doesn't think anything will be ready for years, maybe 3 to 5 years. If you're really lucky and you press it, maybe 2 years.
All right, just such a heartbreaking scene there. Dr. Jon LaPook, thank you so much for your time.
Elaine.